prevent it.
Health experts told senators they cannot predict how the Gulf oil spill will affect local residents or workers involved in the cleanup. John Howard is the director of the National Institute for Occupational Safety and Health. He says so far the most common health complaints are not serious.
Primarily skin and respiratory irritation to various chemicals contained in crude oil and the oil dispersants. Skin contact should be avoided. Any area that has come into contact with oil should be thoroughly washed. Eye, nose, and throat irritation can occur from close contact with crude oil.
Dr. Howard says nausea, headaches, and even emotional discomfort can result over the long term. Workers at sea cleaning up the spill also complain of heat stroke. A mobile public health clinic is now open to treat cleanup workers. Health professionals say children could be particularly at risk.
It's absurd. I mean,
children have higher respiratory rates and higher metabolic rates than adults, and they tend to then take in more of a toxin if it's in the atmosphere. They also have, especially very young children, infants, relatively undeveloped immune systems so that they are less able to fight off infections.
The coming hurricane season could complicate health hazards. Lawmakers expressed concern about storms pushing crude oil and toxins inland, exposing a large number of people to harmful chemicals. Senator Tom Harkin from Iowa.
We have preparedness plans in place for hurricanes. I'm not certain that incorporated into those plans are plans for cleaning up toxic oil spills. I doubt that they're in there.
Dr. Lisa Kaplowitz is the Deputy Assistant Secretary for Policy at the U.S. Health Department.
Quite frankly, once again, we don't know what the impact's going to be, how big the storm surge is. Certainly, we'll intensify our surveillance efforts, our outreach to the community.
None of the health experts at the committee hearing could say how long the chemicals and dispersants will remain toxic. Health department officials are calling for an independent panel of scientists to explore a broad range of health issues related to the spill. For now, the U.S. Food and Drug Administration says drinking water in the region remains safe, and because of a ban on fishing, seafood in stores and restaurants is safe to eat. Vidushi Sinha, VOA News, Washington.